Thank you. Good afternoon to all of you. So, welcome Priyam Gandhi-Mody and Mr. Yadav. So, of course, we'll start with you, Priyam. As you were telling me, this is your third book. And you say you're a strategist specializing in political communication, frequently writing about political non-fiction, and this has been your forte. So tell us what this third book, because you're telling me you're quite prolific. First book was in 19, the second was 20, and now it's 21, and another one is in the works. So that's amazing speed with which you write. But tell me, this particular book, what triggered that, just having completed your second book, that you took this on right away?
Right. Good afternoon, everybody, and thank you for being here. So, Dr. Trehan, the idea to write this book came in immediately after COVID sort of hit India, and the migrants' crisis had begun. So while the crisis was happening and playing out on such a huge scale, our efforts to actually fight the pandemic sort of were not being underlined in mainstream media. And we were doing so much, the country was doing so much, and that needed to be documented, so that it can help in the future if the country is hit with anything similar. So if you see, the book reads in chronological order, like a diary, like India's diary, for example. That's when the idea for the book first sort of germinated.
Yeah, you have conceptualized it well in the sense that it reads easy, and also the timelines and for a reader, it becomes very easy to understand the chronology of how India went through this pandemic. So I'm sorry, Amitabh, they don't have you on my screen. So I'm sure you're there. So hi, good afternoon to you too.
Yeah, Doc, I'm very much here.
Okay, hi.
Hi, how are you?
I'm good, Amitabh. So now, having introduced the idea behind this book, if we go through the way things evolved, the first thing, when India had a 2-month hiatus from when the world started seeing COVID to when we saw it. And it was only that really came to light when we found those 14 Italian tourists who were found to have COVID in Rajasthan, basically here where we are sitting. And that's what triggered the whole story about how are we going to handle it. And I happened to be, they were referred to us at Medanta to take care of them when nobody, even in our organization, had heard of how to handle it. But the facts that came out was, one, that the whole world decided to come on the same platform very quickly, right? And that's when the government also started actually taking very serious meetings in preparation of if it was going to come to India, what would we do? So tell me, Priyam, when the story started basically with the lockdown, when India had it very clear in their sight that it's going to happen, it's going to hit us, and the numbers were rising, lockdown came. What is your take on that?
So I think Mr. Kant also would have been part of a lot of those initial meetings that were happening. At that point in time, we were not prepared. We were simply not prepared to handle a healthcare crisis, a respiratory crisis. So any tool that a country requires to face this kind of crisis, so that's PPE kits, masks, information research about the virus, certain specific drugs, healthcare infrastructure, we didn't have any of that. So to be able to prepare and at least stock up on some of these things, even to spread awareness, enough awareness about precautionary behavior, we needed to take some time, and we needed to keep our people safe while we took that time. Um, and I'm sure, Mr. Yadav and Mr. Kant can shed more light on
No,
how we did
I
that.
am going to pull Mr. Kant in because he is actually on the inside of all these decision makings. So it was actually, I don't think there's any doubt about the fact that the lockdown was required and it happened. And it did give us that window to prepare ourselves, all of us. But in the middle of the lockdown, there were a very sort of heart-wrenching story about the migrants. So, Amitabh, could you put a perspective on what the thinking was, lockdown-wise, what happened in the middle of it with the migrant, and how we handled it? Thank you.
So, Doc, first of all, this was an unprecedented crisis. There's very little parallel in history of any civilization, a crisis of this nature. First of all, we didn't have previous experience of such magnitude before. So we had to get the PPE kits, we had to get the mask going, all of them had to be, we had to get the manufacturing going, which we did. We had to form different groups which could take this forward. But one thing which comes out clearly is that because we are a very vibrant democracy, there was constant feedback. And whatever decisions government was taking, they were based on constant and regular feedback. So even in different committees that were constituted to take action, I think our response in the first phase was very different from the kind of response that we did in the second phase. The crisis of when you do a lockdown of this magnitude, and because there was no global experience available of this nature, we did a lockdown. That lockdown was further extended. Now, when you look at the migrants, these are all gig workers, they are informal workers, they go to cities, they work. When there is no work for over more than 2 weeks, they decide to go home, and there was a huge magnitude of people moving back. That situation was handled in many ways by both the states and the central government. My own feeling is that we need to look at this far beyond this as just a crisis of COVID, as just a crisis of health, because my view is that the pandemic has shown us the need to make healthcare systems more adaptive and resilient. We should learn that to combat future health emergencies, health systems have to be strengthened across prevention, across preparedness, and across response. And to my mind, the primary healthcare system is very, very critical. To my mind, one of the key learning from the pandemic is that we need to, while we've handled it all very well, but we still need to strengthen our healthcare system at the grassroots level in terms of manpower, in terms of infrastructure, in terms of technology. The Ayushman Bharat scheme at the grassroots level, creating 150,000 primary health centers is a very critical component of this. But I still feel that as per the World Bank data, in terms of beds per 1,000 people, we still have very low number of beds per 1,000. If you look at China, it has 4.3, Korea has 12.4. The average upper middle income country would have 3.9 beds per 1,000. So we need to increase the number of doctors, etc. Now, any crisis that we come across in future, and we'll have many more crises because there is a challenge of climate change, there is a crisis of animal health, animal-borne diseases will pose risk to humans in future. We'll need a One Health approach. But whatever we do, We need to ensure that the preparedness at the grassroots level in terms of prevention and our ability to handle a crisis of this nature in future, and these crises will arise in the future. A crisis of this nature has to be handled at the grassroots level. We've emerged as the pharmacy of the world. We've emerged as the vaccine capital of the world. We've done, through Vaccine Maitri, we provided a vast range of vaccines to the world. But I think we still need to focus very, very strongly on our grassroots level, which is really the key to my mind.
Thank you. Thank you for putting the perspective at a very sort of 30,000 feet downwards. Which of course, I believe you're right, that the Ayushman, if we can make it effective at the level that we want it to, that it will make a huge difference in our healthcare and future challenges that may come. No question about that. Come Delta. Now that's the one that knocked the whole world to their ground. I mean, I want to use some other word, but it's not appropriate. What is your take on that? How did we handle the Delta crisis and what you write about? No, you're coming to the vaccine. Okay. Yeah, you're a vaccine specialist.
So, interestingly, when the first wave hit us, as luck would have it, we were it hit us after it hit many countries. So we were able to observe and learn and tailor our response. With Delta, the situation was different. It started with us. So very quickly, we had to figure out the characteristic of the virus, and we had to figure out its clinical symptoms, how it was playing out in the population. And by the time we figured that out, we were already at a community transmission stage. It was already too late. And one of the things that it was doing, it was increasing this rapid increase in the need of oxygen. Now, no country in the world has this kind of liquid medical oxygen at its disposal. So very, very quickly, we had to figure out how we are going to increase this liquid medical oxygen to make it available, how we are going to transport it, and how we are going to make it available to different parts of such a large country. Also, the centers where it was hitting, the Delta was hitting us hardest, were in the north and the western parts of the country. But we were making the oxygen in the eastern parts. So it was taking longer to send the oxygen there.
No, that's the statistics is available. Yeah. But my point is, one, did we make a mistake between the first wave and the Delta wave? Did we let our guard down too soon? So Mr. Yadav, you can also come in here and say, because did we? And it's not it's the public's responsibility also, and there are events that took place. Should we have reacted differently to learn for the future more than criticize the past? So, if you want to say something, you're most welcome, otherwise let her continue. Okay.
So yes, so there was pandemic fatigue, certainly, within the population, within state leadership. We had elections that were scheduled, there were campaign rallies that were going on, we were having religious events of all kinds right in the middle of the Delta wave. And I feel that at some place, many of these organizations should have simply gone ahead and cancelled some of those scheduled crowd gathering events.
Fair enough, you're right. I think that we did make a mistake and that we should learn from that there is no way you can allow huge gatherings or aggregation of crowds in one spot and then escape it. So we paid a price for it. Okay. Coming to the people really suffered in that. We all lost friends, relatives, especially the ones who had comorbidities. So I'll come back to what the lessons from that is later, but Mr. Yadav, please feel free to tell us. In this part, we were also preparing for the vaccine, right? There were two crises that happened. One is oxygen. We never estimated, because knowing very well that our daily requirement for medical oxygen in our country is 2.2 thousand tons a day. And in the middle of the COVID, the Delta wave, it went up to 10,400 tons a day. So the government, on the government's behalf, I can speak that we took all the measures in the sense that could happen. But the real praise goes to the steel industry. They are the unsung heroes in this whole thing. Steel industry, which uses oxygen in such great quantities, repurposed industrial oxygen to medical grade oxygen very quickly. And they were the source that saved India. And the government did. The government, you can say that, I mean, it's an amazing, I don't think it's been done anywhere in the world, that the tankers would take 3 days, 4 days to get filled, to come back filled from, say, Jharkhand or Chhattisgarh to different parts of the country. But the government pressed the Air Force into service to load these empty tankers in the planes, those big Illusion 76s that we bought from Russia many years ago, and we would fly them back into so save those 3 days by 2-3 hours of flight, and then they would get filled there, and they'd be either come by road or put on trains and brought here. So I think that was very unique, and I must give compliment to the government for that. So why don't you elaborate some of the other measures that the government took, and then we'll go on to vaccine.
Thank you, Dr. Trehan. I think a number of instances have been mentioned definitely, and I was the one, I would say, fortunate to see it from inside and do whatever I can do from inside. So we have talked about oxygen, which was really lifesaver, critical. Other things on a similar fashion were ventilators. I think many manufacturers of different things, they repurposed their manufacturing facilities to provide us ventilators. That was another key thing in the whole process. And definitely, I'll talk about vaccines and drugs in whatever way, and Dr. Trehan would like me to answer the questions. But besides this, there was also a time when, in the Delta wave, when we had to we received a lot of assistance in return, I would say. We did Vaccine Maitri, we had drug diplomacy earlier. There was a lot of goodwill for the government internationally, because we never thought that these things like hydrochloroquine or other drugs are meant only to save India's population, but they are meant for the entire world. Similarly, our vaccines, when we started our vaccination drive, within a couple of days, we also helped our neighbors and followed by helping other countries. So when India was in little bit of crisis or in a big crisis at the time of Delta wave, all our friends across the world helped us, and that was because of that goodwill which was generated by our initial help to them. Thank you.
So, you know, the vaccine that really succeeded and to a large degree saved India was the AstraZeneca one, which was licensed to our manufacturers. And that was the one which was ramped up very quickly. At the same time, the government supported Bharat Biotech to develop Covaxine. So this vaccine drive that we saw in India was amazing. You were part of the vaccine drive, I suppose.
Yes.
Right? Before you go on to vaccine, I want to know, do you have any views on where the virus came from?
I think that's very, very difficult question to answer. And WHO, the highest health body in the world, with a very big team of scientists, also could not give a clear answer whether from where the virus came from. Everyone knows it's a bat virus, but how did it come? How it spilled over to human beings? That's a very, very big question, not answered till today, I think. And WHO's team definitely said that the first probability is that it was a kind of a natural transmission from bat to human being. But there were so many questions on that, and there are ground for not believing that by many countries and many scientists and many individuals. And this is because, one, the virus, everyone knows, started from Wuhan, China. And there is a Wuhan Institute of Virology there. And there is research going on since decades on viruses there. And there were reports that before outbreak of COVID, before the first case was reported, 2 to 3 months before that, there were so many scientists of that institute who were admitted in hospitals with COVID-like symptoms. So that doesn't prove, but it is kind of an indication. Second, the WHO team could not find the index case, the first person affected by the virus, which is very, very important to establish. Third, the WHO team could not find an intermediate host, which is also again very important to kind of say emphatically that it's a natural transmission. Why others also raised out was because China did not allow the WHO team for a long time to visit. It took months for the team to visit, and finally when it visited, it did not share the logs of that Wuhan Institute of Virology and other important data with the WHO team. So because of all these circumstantial things, and I would like to say that the question is not still answered. There are intelligence reports of US and British agencies which says that virus was a lab leak. There are many people who believe it was leaked from the lab, but WHO's official position is it kind of, in all, there's high probabilities that it was a natural one.
Mr. Yadav, we all know the official position. And I do sympathize with you sitting where you are today. You couldn't say much. Let's try Priyam saying, then I'll give you my views.
So I agree with these reports that are coming in and the mass public opinion that this is a lab leak. That is my personal opinion on this. Also, because of the internal documents of the lab that are now releasing and that are now available for us to read, they talk of these incidents that had been happening in the months of September, October, within the lab. So what are those incidents? Also, there is a river in Wuhan that separates the wet market and the lab, and all of the initial infections were on the other side, the lab side of the river. Also, this position that a multilateral organization like the WHO is not allowed on the ground, and then they make their report and conclusions based on the little available data is just simply shocking.
Yeah, but look, we all know there are many accusations about WHO being compromised because of whatever reasons or whatever happened. But the basic thing is the smoking gun lies in two ways in China. One, the virus came from Wuhan. Okay, that is clear, because if you want to say whatever, however sugarcoat you want to make it, it came from China. Okay. Second is which is a bigger crime, I think, is not to let the world know that something of this variety is happening, and you lock down your own districts and say, don't report it to the world, and then don't let anybody come in. So I think that the perpetrator is very clear in this whole thing. And then, well, it's come full circle now. But nothing so devastating has happened to the world in the last 100 years. So I think that we should keep this in mind. Not that you can do anything about it, but keep it in mind that there are forces which we are not aware of or which we have no control over. So the only thing you can do is how we prepare ourselves. So I happen to be appointed on the Supreme Court committee that was to monitor the progress and the future preparation for such disasters in the future. And I think that that India, on balance, I must compliment that we did very, very, very well, because there was so much proactive action taking place. And like Mr. Kant said also, many committees, we were interacting with them on a daily basis. So from from number one down, there was a lot of leadership available to respond to people. But ultimately, I think the crown goes to the people of India. On the ground, you should have seen what happened. Even when the migrants got stuck, wherever they were, it was the people of India who actually came to the rescue. So they transported them, students got together to get to money together. I know of a lawyer group that got money together to fly them to their destinations. So everybody pitched in. I think we are today where we are, having lost many people who possibly we shouldn't have lost. But one of the big things that comes out is people who had comorbidities were the ones who suffered the most. So that is an alarm bell that should ring for all of us. And we know very well what those comorbidities are, and the biggest one is diabetes, which is totally under an individual's control, by the way. You may get it, but how you deal with it is in an individual control. So I think if we take all these lessons and take it into perspective as we move forward, I think it would be a very expensive lesson to learn, but a worthwhile lesson to learn as we move forward. So let's go to now the future of development of vaccines. You know, actually what happened was BioNTech, which is a German company, and the scientists sit near Munich or Frankfurt somewhere. They are the ones who are already doing a lot of development of vaccine for cancer. And they repurposed it very quickly, and that's how Pfizer and Moderna was also doing it. But it was not available to India, where vaccine had already been developed by the mRNA on the platform, for a very simple reason, and which was, I think, the right thing for India to do, that they wanted India to give the indemnity of any side effects or any mortalities that took place in India. The Indian government would be responsible, not the company that supplied, which is against all rules of pharmaceuticals. Second thing they didn't want, they were insisting, was that it should be sovereign guarantee, not only in money, but on Indian assets anywhere in the world. Am I correct in that? So what should have India done, if anything, in this scenario where we knew that a very effective vaccine is available, but we can't get it in?
No, I would say that first, we were not that much dependent on that vaccine, and second, it was not suitable for the Indian climate and Indian infrastructure that we have. So, going by first, many of you would know that we are as Amitabh sir said, vaccine capital of the world. We produce 62% of the total vaccines produced in the world and export 77% of them. So that was one. Second, we had a very good 2 vaccines already available. We were among the first to develop vaccine and among the first to roll out vaccination drive. So that was the second reason. Third, our vaccination requires, as Dr. Trehan is a specialist, a cold chain system. And we have universal immunization program where we vaccinate 4 crore people every year, children and mothers every year. So, but that entire cold chain system is suited for refrigeration kind of a temperature, from not very ultra low temperatures, but refrigerator temperature. So our entire cold chain is kind of based on ice-lined refrigerators, ice box and other things. And then due to so many initiatives, support from the government through Mission COVID Suraksha, and also because of our scientists, we had a long line of vaccines, and regulatory simplification kind of motivated more and more vaccines. This mRNA vaccine for mass vaccination wasn't suitable for India because it requires storage at a very, very low temperature. We had no infrastructure for mass vaccination for that purpose. And third, what we did was done very well. You said we refused to give that kind of a guarantee. In US, there is definitely a compensation fund set by the legislature. So if anything goes wrong, then vaccine manufacturer are not liable, people get compensation from them. So we don't have any such fund, and giving such kind of a guarantee was totally unrequired also and not possible also.
Thank you. So now we have 12 and a half minutes left. I want to get a feedback from the audience. Are there questions for which we should save time? Just raise your hand so that I know how much time to keep for that. Okay, all right. Because before we came on, there is a very mean lady on the side who threatened that she was going to hold placards in my face if I didn't finish on time. Okay, so here we go. I want to give a last round of comments from each one. And I know Mr. Amitabh Kant. Are you still there, Amitabh? I know you are.
No, I'm very much. I'm very much there.
You are an amazing guy because you are the Sherpa. I don't know how you find time to do things like this, but tell us, is there a final comment that you would like to give? We have 30 seconds each for each of the authors, or the panelists.
Doc, one thing, there's very important lessons from the COVID story for the future. And what emerges to my mind, and it's very, very important to spell out what are the lessons. Firstly, that testing is really the key to controlling the disease. So any future pandemic of this nature, testing is the key. Secondly, there is no substitute for mask and hand hygiene. That is critical. And that is the role of the citizen. Wearing mask and hand hygiene is the most critical thing. Thirdly, to my mind, the learning lesson from all this are two. One is that lockdowns do not break down the chain of transmission, and they can be short-term solutions, not long-term solutions. So lockdown, from all experiences, show that it's not a long-term solution. Fourthly, I think ventilators were very, very highly overrated, and to my mind, oxygen is really the crux. And lastly, the cities are most vulnerable, as the Delta wave really demonstrated. These, to my mind, are the key lessons. On the vaccine side, I think India's story is remarkable for three things. One is that we were able to provide availability, and I give a lot of credit to both Serum Institute of India for its AstraZeneca, and also through Bharat Biotech for Covaxin. Secondly, availability, access, we were able to provide access to every citizen in India. And thirdly, the affordability at which we have provided it. Fourthly, India's entire journey of vaccination has been digital, and therefore the CoWIN platform has been a remarkable platform through which we were able to administer over 2 billion COVID doses. The entire process was paperless, cashless. We were able to integrate CoWIN with various databases, including passports, which has ensured seamless travel. This has not happened anywhere in the world. And this, to my mind, has been the path-breaking. Yeah.
So now I know, thank you, Amitabh. Now I know where Priyam wrote her book from. So you had given her, okay. So Amitabh, in putting his perspective, has consumed everybody's time. So sorry. You will be now answering questions. So let's see one. Okay, let's start. We'll go even. So let's start from that corner, that gentleman. Yes?
I'm Shubhajit from Leprosy Mission. So allow me to reflect on the past to talk about the future a bit.
But no, just 1 second.
Just for 1 minute.
Yeah, but 1 minute is too long because there are 20 other people. So you'll have to be very quick.
Yes. So I have a request to Mr. Amitabh Kant ji. I know he's very heavily invested in the subject of handling COVID response. I just want a request that please ensure that God forbid, if there is if there's another pandemic, that other diseases should not be deprioritized.
Okay.
when government
Okay.
hospitals and
Yeah,
other
no,
hospitals
I will convey that message to
so
him.
I'll talk,
So
give an
that-
example in terms of leprosy. So there are certain long diseases that require long drawn treatment,
Agreed with
frequent
you.
follow-ups.
100% I agree with you, but now let's not
Yes, yes, yes.
digress from this subject. There's a lady here in dark glasses. Uh, please ask questions. Do not give, suggestions.
Thank you so much. So I'm just I'm talking with reference to the vaccinations, the vaccines. So the vaccines were developed and rolled out very fast, and I'm just asking the government whether we have done any, we are conducting any research into the 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 after effects of the vaccines on the people and how to prevent any after effects.
Good
Yeah,
question. Very good question.
Definitely, this is kind of part of a vaccine development cycle, all phase 1, phase 2, phase 3 trial, and this kind of a research on side effects and efficacy of vaccine. So all the data on side effects is put in the CoWIN portal, and what kind of side effects are there. And from the government side, ICMR scientists and all scientists in different fields, they are doing research on this kind of whether symptoms are the side effects of vaccine. Because there are so many, you are rightly concerned, so many stories, misconceptions are going on. If someone gets a heart attack, people say that he got a heart attack because he is vaccinated, because of the COVID vaccine. But now more than 220 crore people are vaccinated in India, and if one gets a heart attack, definitely there is high probability that the person is vaccinated with COVID vaccine. So it's very, very important, I would like to tell. This is part of vaccine hesitancy as well. And vaccine hesitancy is also as old as vaccines. And sometimes there are right stories, but sometimes, most of the time, there are misconceptions, misinformation, conjectures, and all that around vaccine, which stop people from taking. And I would urge you that the vaccine is very, very safe. And there is no research so far associating it with any severe symptoms. So please go for it. Thank you.
Okay. All right. You made a good pitch. Here's a gentleman here. Now we got to switch sides, and I'll come back to that side.
Thanks for your time, everyone. The question especially is to Mr. Yadav and Mr. Kant. So now we have smiling faces and we are all proud of the response because the results have come out very well. My question to you, sir, is in a country like ours where political storms happen on media every day, in that situation where you see hundreds of people dying every day, how was government able to respond so well from the social political situation in being able to take certain decisions, which in retrospect are coming out to be fine when we see what has happened with Pfizer vaccine vis-a-vis AstraZeneca and Bharat Biotech. But what was happening, how was the government able to actually take the decision, people along, and of course came out well from the response on COVID?
So it's a very long question. I think if you can answer it in 2 words of how well you did. Huh?
Let Amitabh sir
No,
answer.
he'll go too long.
Okay. No, see, I would say that yes, it was a big crisis, and
Do we have any time left?
it was handled very well because of participation and enthusiasm of everyone, starting from the top to the grassroots levels. And I think every one of us was committed to come out successful from this crisis.
No, basically, we have been the greatest manufacturer of vaccines already. So Serum Institute, is well known around the world. So it was possible when we got the technology from AstraZeneca, actually is from Oxford, that we could actually, that they could ramp up the production to a level which has never been seen before, by the way. So that's a good thing. And then Covaxin also came up by Bharat Biotech, which also did well. But India's story behind the scenes of how the vaccine was a remarkable story, how industry and the government worked together seamlessly, also trying to make it affordable. Okay. So anyway, now the next question on this side, and then I'm coming to you. Okay. There's a lady in the, so one more here, then I come back, and then I'll come to this side. Come on. But make it quick, please. And the answer is
Short question, Doc. Is a fourth shot required?
Very good question. Okay, so if you have, well, what we are depending on is what we call one secondary, which is means from the vaccine that your immunity that you are getting, and there is no way of measuring T cell immunity, which we believe is the long term. The body responds by T cell immunity, which is the memory for long term. What we have been measuring is only the antibodies and stuff like that. So that is not telling us anything. But if you have had COVID and you have had 2 or 3 shots of vaccine, I don't think there's anything to say you should get it now. Especially environmentally in India, we are not seeing it actually. For the first time in Delhi, there was 0 case 3 days ago. Okay, now we have somebody in the back there. Hello, there was, oh, here, okay. No, you go ahead, yes, you've been. So we have 1 minute left, so be very quick.
Okay, this question is a clear attempt at putting Mr. Amitabh Kant on the spot, just to ask that our Prime Minister, our Honorable Prime Minister boasted about the Bengal rally during COVID, while people were suffering and did not have basic oxygen facility. He boasted that there were so many people in the Bengal rallies. Would he officially condemn this, yes or no?
Can I take this?
Just 1 second. What did you say?
Can I take this?
Yeah.
So we now have data that everything, all gatherings, including farmers' protests or any sorts of other religious gatherings, other political rallies, the Election Commission had already put like an election schedule in place before the Delta wave began, and all political parties were holding rallies and encouraging political gatherings. So everything needed to be stopped. Every single human being, no matter from which party, has to be held accountable that they did not stop these mass gatherings.
So
that's
would
pretty much
Mr.
it.
Would Mr. Amitabh Kant
just a minute.
officially
No,
on
no,
record
don't
say
get-
that was
don't
wrong?
Don't get personal, excuse me, we don't have time. The basic thing is you got the answer that it was not right. That's it. Okay. There's somebody in the back who's, yeah, so one more question and then we are done, right? Where's that lady? Do you have extra time? All I know is she's, we don't have time. Okay, we got the answer. Okay, one question. Okay, that gentleman in the glasses with the mustache. Yes, sir. No, somebody get a mic to him, or maybe they're not going to give you a mic anymore.
Thank you, Dr. Trehan, for the time. My question is very simple to you. Looking at the current situation of COVID in China, how worrisome we should be in India?
But you know, one thing that Mr. Amitabh Kant also said, testing is the answer. And then if we trace anybody, and now the point is that the government did take some measures of anybody who's connected with China coming into India, and even other random testing is going on, and that's our savior. So if we detect anything, we'll have to respond much more vigorously, but till we detect any numbers, I think that people have that fatigue still there. People are very reticent to wear masks, as you can see around here. How long are we supposed to wear it? Nobody knows the answer. But be conscious of the fact that when you get into a very crowded space, try to avoid them or wear a mask if you're going to. Okay. No, sorry, we have run out of time. They'll never invite me again. You know, they threaten you that way. You don't understand what pressure I'm under. Thank you.
All right.